Today, we're announcing 32 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 549. There are currently 9 individuals in hospital. 4 of them remain in the ICU. 137 people now have recovered and considered to be their COVID-19 infection resolved. We now have 17,419 Nova Scotians who have been tested, but with negative results. So as I've said in previous briefings, it's a good story as far as I'm concerned. We were testing lots of people. The vast majority of people are testing negative. And we have the appropriate steps in place to deal with people who test positive. And again, thank you to the lab. Yesterday, they tested again over 800, or they tested 885 tests, and so we remain one of the leading provinces in terms of our ability to have a high throughput of testing for our citizens. I know I've been asked yesterday about my decision to allow the parking lot Easter service. I wanted to address that again today because I know that there continues to be lots of discussion and criticism about my decision on social media. I made, as I said yesterday, I made this decision when a group, through their local councillor, brought forward their request with a clear rationale, as well as clear steps that were going to protect their safety while they held their parking lot service. So I approved that, gave them an exception to my order under the Health Protection Act. I know that not everybody agrees with this decision. And I do understand that making exceptions can create confusion. A lot of faith communities are doing virtual worship, but I'm also cognizant that this may not always be possible, especially in rural areas where access to internet may be more challenging. However, we all need to be creative as we deal with COVID-19 in our communities and our homes, including practicing our faith, and many people are finding innovative ways to do that. So we're going to ask churches to and other faith groups to continue to do that, and going forward, drive-in church services will no longer be allowed. The message we had yesterday that from the modeling, that is, we are at a critical point, or we remain at a critical point as in our response to COVID-19, and there are severe and serious implications from COVID-19. So it's extremely important that we continue to stick with our strategy of all of Nova Scotians sticking with the strong public health measures, staying home, gathering in groups of 5 or less, only when necessary, and only going out of your community for essential shopping or those who are still working. The more we do this, the less will be the impact from COVID-19, and the sooner we can return to normal. So I think it's really important that we stay focused on that, on what's necessary to get through this with the least impact and as soon as we can. I just want to talk about something briefly that struck me, and it came my way yesterday. From nationally, from around people who are blind or visually impaired. They've raised the issue about that for them, we need to be cognizant and asking the general public to be more aware that even though generally we're asking people to practice social distancing and be careful when you're out about in public, that while many people who are blind or visually impaired are very independent, but there may be circumstances where they actually need help from somebody that may require somebody breaking that rule around social distancing. So I ask people to just be cognizant of that if there is somebody who's visually impaired who looks like they need help, please offer your help. Even if that does mean you have to break that social distancing, that's okay on those circumstances. Doing it in a way that, if they're respecting hand washing, minimal touching each other, even trying to avoid getting face to face. But if somebody needs a hand on their elbow or just a voice to help them, please offer that. And this is not just for the visually impaired or the blind community. we have to understand there are many people in our communities with a range of disabilities that have unique challenges when it comes to dealing with all the rules we have put in place. So it's especially important that we think about, and in the government we are doing this. We have a special focus on people with disabilities. I would ask as I've asked people to do a lot around being caring, building community, that we take a particular focus as we're doing that on those because of a range of whether it's physical or intellectual disabilities may need extra supports and acknowledgement of the challenge that they may be facing at this time.